Salam alaikum. Now I would like to talk about a very important topic called this fetal alcohol syndrome. Fetal alcohol syndrome. What happens in fetal alcohol syndrome? The pathophysiology is a mechanism is impairment of migration of neuronal and glial cell, impaired migration of the neural and glial cell, impaired migration of the neural and glial cell. In fetal alcohol syndrome, there may be lots of problems starts from above. That means there may be microcephaly, small head, small palpable fissure, flat nasal breeze, smooth philtrum, thin vermilion border, smooth philtrum, thin vermilion border, flat nasal breeze, small palpable fissure, and microcephaly. And microcephaly, these are the features you get in fetal alcohol syndrome. Lots of question comes from here and there regarding this. So we'll remember from above that microcephaly, small palpable fissures, flat nasal breeze, smooth philtrum, and thin vermilion border. Okay, next. Neonatal abstinence syndrome. It's a complex disorder involving CNS, ANS, and GI. Complex disorder involving CNS, ANS, and the GIs. Secondary to maternal substance abuse, more commonly opioid. Opioid is the most common criminal for neonatal abstinence syndrome during pregnancy. Newborn may present with uncoordinated sucking reflex, irritability, high pitch crying, tremor, tachypnea, sneezing, diarrhea, possibly seizure. So uncoordinated sucking reflex, irritability, uncoordinated sucking reflex, irritability, high pitch crying, tremor, tachypnea, sneezing, diarrhea, and possibly seizure. Treatment for methadone, morphine, and buprenorphine. Treatment for opioid use is methadone, morphine, and buprenorphine. Universal screening for substance use is recommended in all pregnant patients. Okay, will come this sort of thing later on, the anatomy things, but I want to go through these important things. Genital embryology, mesonephric female default development, mesonephric duct degenerates and paramesonephric duct develop. Mesonephric duct MD fails in female, MD fails, but PD develops. In female, MD fails, that means mesonephric duct fails, degenerates, and paramesonephric duct develops. In male, there is SRY gene on SRY gene on Y chromosome produce testis determining factor and testis development, produce testis determining factor and testis development. In male, SRY gene on Y chromosome produce testis determining factor and testis development. Sertoli cells secrete Mullerian inhibiting substance MIS, also called anti-Mullerian hormone that suppresses development of paramesonephric duct that suppresses the development of paramesonephric duct. Leydig cells secrete androgen that stimulate the development of Leydig cells secrete androgen that stimulate the development of mesonephric duct. Leydig cells secrete androgen that stimulate development of mesonephric duct. Paramesonephric duct develops into female internal structure fallopian tube, uterus, proximal vagina, distal vagina from urogenital sinus. Male remnant is appendix testis. Male remnant is appendix testis. Paramesonephric duct. If there is a problem in paramesonephric duct in male, SRY gene on X chromosome produce testis determining factor, and thus testis development happens. Thus there is testis development happens. In paramesonephric duct, in paramesonephric duct, paramesonephric duct also. So mesonephric duct uh, in MD degenerates, in female MD degenerates, and PD develops. In male, SRY gene on Y chromosome produce testis determining factor and testis development. Sertoli gel secrete Mullerian inhibiting substance. Sertoli cell secrete Mullerian inhibiting substance that suppress development of paramesonephric duct. Paramesonephric duct. Leydig cells secretes a test androgen that stimulates development of mesonephric duct. Paramesonephric duct development of female internal structure, fallopian tube, uterus, and proximal vagina. Male remnant is appendix testis. Male remnant is appendix. Mullerian agenesis, Mayer Rokitansky, Custer-Hauser syndrome, Mayer Rokitansky, Custer-Hauser syndrome. It's a primary amenorrhea with absent uterus, blind vaginal pouch. In Mullerian agenesis, Mayer Rokitansky, Custer-Hauser syndrome, primary amenorrhea with absent uterus, blind vaginal pouch, normal female external genitalia, and secondary sexual characteristics, functional ovaries, associated with urinary tract anomalies like renal agenesis, associated with urinary tract anomaly like renal agenesis. Mesonephric duct develops into male internal structure except prostate, seminal vesicle epididymis, ejaculatory duct, and ductus deferens. Seminal vesicle epididymis, ejaculatory duct, and ductus deferens. Female remnant is Gartner cyst. Female remnant is Gartner cyst. Gartner cyst. Female remnant is Gartner cyst. In this, the sexual differentiation. In sexual differentiation, we know that from mesonephric duct and Wolffian duct. Mesonephric duct or wolf is male, and paramesonephric or Mullerian duct is for female. So paramesonephric duct. It's from here the internal female genitalia that uterus, fallopian tube, uterus, and proximal vagina develops from here. And mesonephric or Wolffian duct. From this duct, there is a development of internal male genitalia. That means seminal vesicles, epididymis, ejaculatory duct, and a ductus difference. Seminal vesicle, epididymis, ejaculatory duct, and ductus difference. From undifferentiated gonad, in case of XY, in case of XY, in case of testis, in case of XY, undifferentiated gonad, XYSRY gene, presence of SR and testis stimulates Leydig cell to secrete testosterone, and testis secretes stimulates Sertoli cell to release Mullerian inhibiting Mullerian inhibiting testosterone. Leydig cell secrete testosterone. Testosterone will stimulate internal male genitalia to grow, and testis will secrete 5-alpha reductase to convert into dihydrotestosterone, by which external male genital PPS, penis prostate, scrotum develops. Mm, Testosterone will also stimulate to produce secondary sexual characteristics: pubic, axillary, facial hair, increase penis size, length, and growth. Mm, mm, mm. Testis will secrete Mullerian inhibiting Mullerian. Mm, Undifferentiated gonad XX ovaries will secrete estrogen and testosterone. Estrogen will stimulate external male genitalia. Estrogen will stimulate um, um, estrogen will stimulate external female genitalia to develop CLD. That means clitoris, labia, distal vagina. Clitoris, labia, distal vagina. And this estrogen will stimulate for breast development, and from ovaries there is development of testosterone, which will stimulate to grow the pubic and axillary hair. Axillary hair, pubic and axillary hair, and internal female genitalia will develops from paramesonephric duct. Duct.